Hi, I hope everyone's having a nice day. This is MedBreak, where I, a resident physician, to feed you information about medical education, but really about seeking the sense of fulfillment in anything that you do during your break. We're in the middle of a 3-part series where I'm trying to convince you not to become a doctor, and this is part 3. The first 2 parts covered the training process from the day of your high school graduation all the way to become an attending, but in this part 3, I want to talk about relationships and money. I wanted to leave love and money as a separate section because those 2 things are something that you will talk a lot about after graduating from undergrad. Dating becomes difficult after undergrad because of the time constraint and the financial constraint. Hooking up is a little bit of a different story. You can do that anytime in your free time if you want. But I think people tend to get a little bit more serious as they get older. Maybe some of you are thinking of settling down already. But plenty of my classmates were on Tinder and OkCupid having a lot of fun. Some of you might have to do long-distance relationships. Out of the 20-ish couples that I've seen during my medical school who's trying to do long distance, I have not seen a single one work out. I'm sorry. I'm sure it is possible. Especially if you're already married, then all of those worked out. No one got a divorce that I know of during medical school. But if it's like a girlfriend, boyfriend relationship, then I haven't seen any that last until the end of graduation. Because you get so lonely fast, you start looking at each other, your classmates, for better or for worse, because that's just who you have around you. There's one very unique thing that happens when you're dating another classmate in medical school, and this comes when you're about to decide where to go for residency. Remember that I said you get placed into one location. Meaning, if you want to continue your relationship with your significant other, then it is ideal that that person is in the same location or really close to where you are. So this is where couples matching come in, where both of you can try to enter into the similar location. It'll be easier to go where both of you want if both of you have very good stats and you did really well on your scores and you have a really impressive application. But what if you don't? What if one gets placed in New York and the other one in Southern California? You'll have to do long distance while juggling the very busy residency life schedule. And then family planning gets really difficult and it might not work out, or maybe your love is strong enough and you'll make it work. So most of you can deal with being poor and busy. That's what you've been your entire life, and you can make it work because you really enjoy the other person's company. But here's probably what's the most difficult. Dating people outside of medicine poses its own problems. You need to meet someone who is very understanding of your responsibility and your schedule. You won't be home for dinners, you will leave early for patients, you'll have to work night shifts, you have to be on call, and vacations, if any, are very rare. What if you want kids? And what about your partner's careers? And where are you going to live? Where are you going to do this and that? It all becomes a potential topic of headache and argument with that significant other if they have a hard time understanding your situation. About 50% of physicians marry another physician. I married a doctor, my wife is a doctor, and it's the biggest mistake that she made. Let's talk a little bit about the money. The tuition on average, I don't have the answer, but we know that the average student loan that a medical student leaves after medical school is around $190,000. Mine was around $200,000. And I think that's on the lower side. If you go to a private institution in a very desirable location like New York, then your loans can be upwards of $350,000 after graduation. And I already mentioned that you have to start paying 6 months after you graduate. The interest rate is around 5 to 7%. It was only 2% about 20 years ago. There are programs that pay for your student loan, like the Public Service Loan Forgiveness Program called PSLF, but they're always talking about getting rid of it. And it does limit your choice of where you can practice after residency too, because you have to practice in a location that is supposedly underserved. However, in 2018 and 2019, out of the 50-some thousand people who applied for this program, only 1% was able to collect this benefit and pay off their student loans. So there clearly are some things that's not working. A lot of people just drop out of it, or it's not working as it should. You can get the US military to pay for it, but that also limits your options for residency because you have to go to a military affiliated hospital to do your residency there, and also serve in the armed forces as a doctor for several years until you can go wherever you want. And there are what I like to call definitely hidden fees in medical school education. Every major tests, like the MCAT or boards, usually require extra resources to do really well, whether it be books or question banks or getting professional help. It just costs a lot of money, I would say in the thousands. And preparing medical school applications or residency applications and then going on these interviews, preparing for these interviews, there are major companies built around to help you prepare for these events. I would say they cost from hundreds to thousands, depends on what you're looking for, if you want to use these services. I know because I used to work for one. During the 4th year of your medical school, some students go on away rotations, and these are where you leave your home institution and go to a different hospital to kind of check out their program and see how they're like. Or maybe you just want a different environment overall and maybe learn things from different doctors that you admire. The medical school doesn't pay for that. That all comes from your own pocket, where you have to find your own Airbnb or a cheap inn or a family's place to stay in while you do your rotations, and you'll be paying for your own travel and your food as well. Speaking of travel, when you do go on these medical school and residency interviews, they all come at a cost of having to travel, usually a plane ride or very long car ride, so you have to pay for gas, usually a hotel, more likely a Airbnb, food, and these are all costs that will cost you thousands every time you have to go on an interview. And this is all the while your friends are saving up on retirement, for vacations, for weddings, for cars, getting promoted. They basically get a 10 to 15 year head start while enjoying their money much more than you are. Even after you become a doctor, your salary won't change much unless you go to a different location. You probably have to go to a place where a lot of doctors don't want to get a really good salary or high salary. If you choose to live in a place that's more popular, then your salary will decrease because there's just less demand for your services. Let's take a break and briefly do a snack review. I'll be talking about these vitamin gummies. No, they're not a snack, but yes, we do eat it like a snack. There's no evidence to suggest that for healthy individuals, these vitamin supplements actually do you any good. Yet, we still eat them. So basically, treating it like a snack. I know that it doesn't help me because I'm relatively healthy, but I still eat 2 of these a day religiously. I don't know why, probably just because it tastes good. Kind of a related story. When my wife was pregnant with our son over here, she was having some trouble and I bought her fiber in the form of a jelly to help her with her bowel movements. And once I was in my house and I was so hungry. There was nothing in the house, no snacks, no food, no nothing. I don't want to really go out to eat anything or do a takeout or delivery. So I started eating the fiber jellies. And at the time, I didn't really think that they were really effective because they weren't really helping my wife. So I ended up finishing the entire container and just went about my day. For the next few days, I'm having watery stools like never felt before. And I was so confused. I didn't feel sick. I felt fine, and my stomach was fine. Later in the week, my wife comes in and notices the empty container of fibers in the recycling bin. That's when it dawned on me, I did that to myself. Back to the video. So here is the deeper meaning. I usually like to inspire students, and I actually hope that I did. The bumpiness of the road to becoming a doctor is presented sometimes in a too abstract light, when there are real, tangible difficulties and challenges that may have very long-term effects in your life. And not knowing what you're getting into, I think, contributes more to mental stress, anxiety, and burning out later during your training. Of course, if no one became doctors, that wouldn't be good. And that is not my goal at all. I did paint a very grim picture, but once you get into medicine, it is actually not that bad. Medicine is a very rewarding career, so they say. Before you ask yourself, should I become a doctor? A more fundamental question is, do I know enough about medicine and what a doctor does on a daily basis to actually make an informed decision? I don't know is okay, so go find out. I love asking, what do you want to do with your life? And if a student says, I don't know, then I ask them, so what do you need to do to find out what you want to do? Talk to doctors, both the positive and the enthusiastic types, and the jaded types. Just go out and find more information. It's cool to talk to people and find out more about the field. That's not through a TV show, obviously. Talk to patients, talk about diagnosis, treatment planning, counseling, procedures, surgeries, collaborating, teaching, working with administration, scientists, the public, and the government. Go see it for yourself. Don't take anyone's else's word for it. There is a group of you who's been carefully listening to what I've been saying and has been thinking, oh, that's not that bad. I don't really like partying and I like challenging myself. That actually doesn't sound too bad. And I was in your shoes. There is another group of you who, when I started talking about all the difficulties and challenges, your heart started bumping harder and blood rushing to your brain because you were so excited and you can't wait to go down this path. There isn't a diagnosis for what you have, but there should be. Welcome to the club. I have zero problem telling you to not become doctor as a doctor, even if you're doing it for the right reason. It's like Matt Damon telling children who want to become actors not to become actors and actresses. I'm just a slightly less attractive version of Matt Damon, and he's Asian. Because what I say should not matter to you if you're properly motivated, and that's the bottom line here. I simply gave you more specifics on what you already know. And in the future, even more people might tell you to not do it. And sometimes even you might convince yourself to drop out, maybe a little too late. And once they come into medical school, many people do drop out either voluntarily or involuntarily, and that is just terrible to see. You need to have chosen to become a doctor despite these challenges and sacrifices, sometimes even welcoming them, seeing as opportunities for growth. You kind of need an unrelenting drive to see it through the end. It's definitely gonna suck, but apparently not as sucky as not becoming a doctor. Since so many students struggle wondering if they should become pre-meds or not, I always tell them, choosing to become a doctor is as great of a choice as choosing not to become a doctor. They're equal. Equally awesome, equally okay. If you choose to go down this path, then you will have to develop good time, stress, money, and relationship management skills. It's not like you can't complain. It is okay to complain, and we definitely complained. We complained the entire way through. It was a whine fest entirely through the medical school process. We even complained during graduation. If you're really struggling in the process, there are usually resources to help you out. In my medical school, they had tutoring at the very least, they had counseling, psychological services, and they were really accommodating in terms of giving you extra time or maybe even extending a year. In the end, you want to become a doctor for the right reason. And it starts with a P, say it with me, prestige. I mean patients. Do it for the patients. So of course, any doctor can tell you how great it is to work with patients, and it is, to convince you, but it's something that you should really try to feel for yourself by trying to be in those healthcare related experiences. See what a doctor actually does for a patient and see its effect and see if that's something that you want to dedicate your life to the point that dealing with everything that I said becomes just a unfortunate thing you just have to do to become a doctor. None of the doctor will say to do it for the money or to make your parents happy. Once you have decided to become a doctor, or not, remember both are excellent choices, start running. Just run towards whatever goal you have. But remember, don't become a doctor. I can't wink. One final note, if a 10 to 15 minute YouTube video convinces you to not become a doctor, then you probably shouldn't become a doctor anyway. That's it for the part 3 of this video and the end of the series. I hope I've thoroughly convinced you to not become a doctor. But remember, this is just me talking. Do whatever you want to do. Whatever you want to do, not what someone else wants you to do, including someone on YouTube telling you to not become a doctor.
1, 2, 3.